5:43 a.m. Level 3 parking garage, St. Ark Medical Center. While most people are waking up in warm beds next to people they love, Amanda Peterson is waking up alone in her car. For the past 4 months, this 2018 Honda Accord has been her bedroom, her sanctuary, and her sacrifice. She slept here 127 nights straight because going home means something unthinkable. It means potentially killing the patients she's sworn to protect. In 3 minutes, Amanda will walk through those hospital doors to begin another 12-hour shift, caring for COVID patients in the ICU. She'll check ventilator settings, administer life-saving medications, and hold dying patients' hands when their families can't be there. And tonight, she'll sleep in this car again. Because sometimes being a hero means sacrificing everything, including the comfort of your own home. This is the story of the nurse who chose her patients over her family, her calling over her comfort, and her duty over her own well-being, and why her decision to sleep in a parking garage saved more lives than any medicine she's ever administered.
Meet Amanda Peterson, 43 years old, registered nurse with 16 years of ICU experience. Before March 2020, she lived in a 3-bedroom house in suburban Columbus with 2 people she'd do anything to protect. Maya, her 17-year-old daughter, senior in high school, dreaming of college, and Eleanor, Amanda's mother, 78 years old, diabetic, recovering from a mild heart attack 6 months earlier. Amanda's world revolved around caring for people. Her ICU patients during the day, her family at night. She'd worked through flu seasons, SARS scares, and every medical crisis of her career while maintaining the perfect balance between professional duty and personal love. Then, COVID-19 changed the equation forever. March 15th, 2020, St. Ark Medical Center was implementing emergency COVID protocols. The ICU was being converted to house critically ill coronavirus patients. Amanda was assigned to the new COVID ICU. The risks were unknown but terrifying. Healthcare workers were getting sick. Some were dying. The virus was highly contagious, and asymptomatic transmission meant you could spread it without knowing you were infected. Amanda had to make an impossible choice: continue working with COVID patients and risk bringing the virus home to her immunocompromised mother and college-bound daughter, or quit the job she dedicated her life to when patients needed her most. She chose a third option that no one saw coming. March 22nd, 2020. After her first week caring for COVID patients, Amanda made a decision that would define the next 4 months of her life. She couldn't risk exposing Eleanor and Maya to a virus that could kill them, but she also couldn't abandon her patients when they needed skilled ICU nurses most desperately. So Amanda Peterson moved into her car, not because she had to, because she chose to. The first few nights were brutal. Amanda had never slept anywhere but a bed in her adult life. The car seat wouldn't fully recline, the parking garage was cold and noisy and lit by harsh fluorescent lights that never turned off. She tried sleeping at different angles, wrapping herself in hospital blankets, using her uniform jacket as a pillow. Every position was uncomfortable, every sound woke her up. But by the end of the first week, Amanda had developed a system: car window covers for privacy, a memory foam cushion for the seat, a routine that made the impossible barely tolerable, because the alternative was unthinkable. Amanda's days followed a brutal routine: 7 a.m. to 7 p.m. in the COVID ICU, caring for the sickest patients in the hospital. Patients on ventilators fighting for every breath. Families who couldn't visit saying goodbye over video calls. Then back to the parking garage. Dinner from the hospital cafeteria, eaten alone in her car. Phone calls with Maya and Eleanor, pretending everything was normal while sitting in a Honda Accord that had become her entire world. Showers in the hospital locker room, clothes stored in her trunk, personal belongings reduced to what could fit in a backpack and small cooler. Amanda had voluntarily made herself homeless to keep other people safe. The car became Amanda's entire universe. 12 feet long, 6 feet wide, Her bedroom, dining room, office, and sanctuary all compressed into the space most people use just for transportation. Family photos covered the dashboard. Maya's acceptance letter to Ohio State University was taped above the radio. Eleanor's latest medical results were filed in a folder behind the seat. Amanda could see her patients' rooms from her parking spot. She'd watch the lights in the COVID ICU and think about the families she'd helped that day, the medications she'd administered, the hands she'd held as people took their final breaths.
Home was a car, but her heart was still with the people she was protecting, both inside the hospital and at her real house 15 minutes away. The hardest part wasn't the physical discomfort, it was the emotional isolation. Amanda FaceTimed with Maya every night, helping with homework, discussing college plans, trying to be a present mother through a laptop screen. She video called Eleanor multiple times daily, monitoring her mother's health from a parking garage, unable to check her blood sugar, adjust her medications, or simply give her a hug when she looked tired. Maya was accepted to Ohio State University. Eleanor celebrated her 79th birthday. Amanda attended both celebrations virtually, watching through a phone while sitting alone in her car. She was sacrificing the most precious moments of their lives to protect their lives themselves. By April, Amanda's colleagues had figured out she was living in the parking garage. They started bringing extra food from home, offering spare bedrooms, expressing amazement at her dedication. But Amanda declined their offers. Accepting help meant potentially exposing other families to the same risks she was protecting her own family from. "If I'm going to do this," she told her nursing supervisor, "I'm going to do it completely. Half measures don't work when people's lives are at stake." Amanda had turned isolation into a form of love. During the April surge, Amanda's COVID ICU was at capacity. 24 critically ill patients, most on ventilators, some not expected to survive. Amanda was assigned the sickest patients, the ones requiring constant monitoring, complex medication drips, and the kind of skilled nursing that makes the difference between life and death. She held phones so dying patients could hear their families' voices one last time. She adjusted ventilator settings that kept people breathing. She administered medications that bought precious hours for recovery. And every night, she returned to her car knowing that her sacrifice was the reason she could provide this level of care without fear of taking the virus home. These hands have started over 15,000 IVs in 16 years of nursing. They've administered countless medications, performed chest compressions during codes, provided comfort during the scariest moments of people's lives. During COVID, these hands became even more critical. They were the only human touch many patients experienced in their final days. They operated life-saving equipment when families couldn't be present. But at night, these hands held a steering wheel instead of a loved one. They touched photographs instead of real faces. They texted messages instead of giving hugs. Amanda's hands saved lives by staying away from the people she loved most. May 18, 2020. Maya's high school graduation. Amanda watched the ceremony on her laptop from the hospital parking garage, wearing scrubs instead of the dress she'd bought months earlier. She saw Maya walk across the stage, accept her diploma, and look toward the camera, knowing her mother was watching from 15 miles away. After the ceremony, they video called for 20 minutes. "I'm so proud of you, baby. I wish I could be there to hug you. You are here, Mom. You're always here when I need you, even when you're not physically here." That conversation sustained Amanda for another month of sleeping in her Honda Accord. By late May, Amanda had become an expert at living in her car. She knew which parking spots got the best cell phone reception for video calls. She had identified the quietest hours for sleep. She had created storage solutions that maximized her tiny living space. Other hospital staff started calling her the parking garage nurse. Some thought she was crazy. Others recognized her sacrifice as the most profound act of love and dedication they'd ever witnessed. Amanda didn't see herself as heroic. She saw herself as doing what needed to be done to protect the people who mattered most, her patients and her family. But living in your car for 4 months to prevent spreading a deadly virus is the definition of heroism.
June 2020 brought the first glimmer of hope. Vaccines were becoming available for healthcare workers. Amanda was among the first to receive her shots. 2 weeks after her second vaccination, she had the conversation she'd been dreaming about for 4 months. She could go home. But after 127 nights in her car, the decision wasn't as simple as it seemed. June 28, 2020, Amanda Peterson slept in her own bed for the first time in 4 months and 6 days. She woke up multiple times that first night, disoriented by the silence, the softness of her mattress, the familiar smell of her own sheets. Her body had adapted to living in a car. But more than the physical comfort, Amanda was overwhelmed by the emotional reunion. Hugging Maya, making breakfast for Eleanor, sitting around their kitchen table as a family. Simple moments that felt miraculous after months of separation. Returning to normal life didn't diminish Amanda's dedication to her patients. She continued working in the COVID ICU, caring for critically ill patients with the same skill and compassion she'd always provided. But now she could go home after her shifts. She could help Maya prepare for college in person. She could monitor Eleanor's health directly instead of through video calls. The sacrifice had been temporary, but the impact was permanent. Amanda had proven that love sometimes requires the hardest choice of all, staying away. Amanda wasn't alone in her sacrifice. Across the country, thousands of nurses made similar decisions during the COVID pandemic. They slept in hospital parking lots, garage apartments, basement rooms, and hotel rooms paid for with their own money. They isolated themselves from their families to protect vulnerable loved ones from a virus they were exposed to every day at work. Some healthcare workers didn't see their children for months. Others missed births, graduations, birthdays, and holidays. They sacrificed the most precious moments of their personal lives to save the lives of strangers, and most of them never received recognition for this profound level of dedication. Amanda's Honda Accord is back to being just a car, but it carries the memory of 4 months when it was so much more. The pillow was still in the back seat. The family photos remain on the dashboard. The organizational systems Amanda created are still there. Reminders of when this vehicle was her entire world. Sometimes Amanda sits in the parking garage after difficult shifts, remembering those nights when her sacrifice felt overwhelming but necessary. When choosing her patience over her comfort was the only decision that felt right. That car represents the most defining months of her nursing career.
Today, Maya is thriving at Ohio State University, majoring in pre-med, inspired by her mother's dedication to healthcare. Eleanor's health is stable, and she lives independently in the same house where Amanda grew up. Amanda still works in the ICU at St. Ark Medical Center. She still cares for the sickest patients, still holds hands during final moments, still provides the skilled nursing that saves lives every day. But now, she goes home to her own bed every night. She has dinner with Eleanor. She video calls Maya to help with college coursework. The sacrifice taught her what she'd always known but had never fully appreciated. That home isn't just a place, it's the people who love you unconditionally. Right now, there are approximately 500,000 ICU nurses working in hospitals across America. They care for the sickest patients, make life and death decisions every shift, and carry emotional weight that would crush most people. During COVID, many of them made sacrifices that went far beyond their job descriptions. They isolated from their families, moved out of their homes, and chose patient safety over personal comfort. They worked longer hours for the same pay. They dealt with PPE shortages while facing increased exposure risks. They held dying patients' hands when families couldn't be present. And they did it all while risking their own health and sacrificing time with their own loved ones. These aren't just healthcare workers. They're people who chose others over themselves when the world needed them most. They're professionals who redefined dedication during the greatest public health crisis of our lifetime. They're mothers who didn't hug their children for months. They're daughters who couldn't visit aging parents. They're spouses who slept apart to protect their families. They're heroes who didn't wear capes or get parades. They wore scrubs and made sacrifices that most people will never know about. And they deserve our recognition, our gratitude, and our respect for proving that true heroism sometimes means giving up everything that matters to you personally to protect what matters to everyone collectively. When I asked Amanda if she regrets those 4 months living in her car, her answer revealed everything about the heart of a true healthcare hero. "I regret that I had to make that choice," she said. "I regret that the pandemic put healthcare workers in impossible situations. I regret missing so many moments with Maya and my mother. But I don't regret making the choice I made. Every patient I cared for during those months received the best possible care because I wasn't worried about bringing the virus home. Every life I helped save was worth every uncomfortable night in that car." Sometimes love means staying close. Sometimes love means staying away. A nurse learns to do both. If Amanda's story opened your eyes to the incredible sacrifices ICU nurses made during COVID, share it with someone who needs to understand that healthcare heroes gave up far more than we realized to keep us safe. If you know an ICU nurse who made similar sacrifices during the pandemic, take a moment to acknowledge what they gave up for their patients. Thank them not just for their medical skills, but for their personal sacrifice. And if you are an ICU nurse who made impossible choices during COVID, remember Amanda's words. Your sacrifice saved lives. Your dedication protected families. Your choice to put patients first, even when it meant giving up time with your own family, represents the highest ideals of nursing. You didn't just provide medical care, you provided hope, healing, and humanity during the darkest period of our lives. The next time you see an ICU nurse, know that they've probably made sacrifices you can't imagine to provide the care that saves lives. Subscribe to The Quiet Brave for more stories about the people who sacrifice everything to care for others. Hit the notification bell so you never miss a story that might change how you see the heroes who work around you every day.